All right, so we got some questions about how we address central sensitization. Step one, we have to make sure that there's no other physical causes of pain first. So we don't want to go into a situation where we're thinking that the pain is a result of someone's nervous system and their brain, when it could be a result of something like an inflammatory disorder, or they have a badly herniated disc that is contributing towards their pain experience. Step two, we want to make sure that we address any mental contributors to someone's pain experience. So, this might mean that someone has false beliefs about pain, meaning they think that they have this really bad, terrible spine and that it's never going to get better, then that's going to be a contributor towards their pain experience. Also, if someone has underlying anxiety or depressive disorders, and some of these things may need to be treated. Now, this doesn't mean that they need to be treated with medications automatically. Some people respond really well to breath work, other people respond towards cognitive behavioral therapy. And yes, some people may need medications in order to address that, but addressing the mental component is super important. Step three, we have to decouple the idea that when you do something that increases your pain, that it's making the injury worse. People with chronic pain tend to have this belief that if they do something that increases the amount of pain they're experiencing, that means they're causing more damage to the injured body part. But like we talked about before, sometimes the increased pain is actually from neurons firing too aggressively, and it has nothing to do with any tissue damage at the level of injury. When people have this idea removed from them, it actually helps them realize that they could actually move into the pain without actually causing any damage. By helping your body move through the pain, it could actually create some long term benefits down the line by using exercise therapy. Step four, we want to try to create windows of opportunity in which someone experiences less pain with a triggering type of movement. So, for example, if it hurts to turn your head to the one specific side, and we want the person to start to turn their head more, we might use different sensory techniques to try to help to open up that window of opportunity where someone can turn their head and it doesn't trigger pain. This might mean turning the body on top underneath the head. This might mean using sensory therapies like light touch. It might mean using breath work before they start turning their head. But we just want to open up a tiny little window of opportunity where the brain doesn't experience that pain so we could use exercise as medicine for future visits. Step five, start to build resiliency. So, when someone can experience a window of opportunity in which movement doesn't cause a catastrophic pain response, then they could actually start to build tissue resiliency through our favorite methods, which are going to include aerobic exercise and strength training. And by doing those things, it actually changes the way that your brain is wired to experience pain. And that's where movement can be really powerful medicine.